and Dr. Marivic is busy at the moment. She might not be able to come in. She has an event with her daughter, and she's currently on a train, so she can't get on.
Yeah, but we have you and we have Doc Alan Landrito tonight. So magandang gabi, Doc Alan.
Yes, good evening. Are we on air now?
Yes, we are.
Good evening to everyone. Welcome to the Cdc Ph huddle, Flatten the Fear. And we're here again because they are putting out a lot of fear mongering again. So we want to flatter the fear. And we will do it scientifically to explain to you. So wisdom is primus, So we know what we're facing with, what we have, our strength, the strength of our enemy, then we will win any kind of battle. No, so CDCPH is designed for us to help people here in the Philippines to overcome all these problems. Naman, we have been encountering a lot of misinformation and misleading from different corners. No, so that's what we're going to do, and we will start. We have to have our disclaimers and the other things that we used to do. Can you flash the slides, Francis? Yes, the CDC Ph 5-point agenda. I will start. CDC says yes to freedom of speech and open access to all information to achieve genuine informed consent. Sally?
Yes to individualized healthcare, as it is the best form of medicine. There is no such thing as universal healthcare, as each person is unique. The sanctity of the doctor-patient relationship must remain inviolable, and medication and treatment must always be based on individual cases, not on a one-size-fits-all basis.
Yes to respecting natural immunity from natural infection. When viruses evolve, the human immune system adapts.
No to mandatory vaccinations, medications, and treatments, most especially for children. Medical treatments and options are each person's constitutionally guaranteed individual choice, not governments.
And no to globalized, centralized health regulations dictating medical intervention. The government's job is to protect its people, not to submit them to the wishes of unelected foreign corporations or agencies.
Okay, so those are our 5-point agenda. You can join us at the Viber group by going through this QR code. You can scan it now. Yeah. And that's what we do in post-pandemic medical health advocates for vaccine during the PPMH. Flatten the fear and we heal. Now we have the disclaimers. No, number one, CDCPH is not an anti-vaccine, but unsafe, ineffective, and harmful vaccines. Sally, number two.
Sorry, here I am. The views and opinions expressed on this program are not necessarily those of the concerned doctors and citizens of the Philippines. For a proper medical diagnosis of your condition, please consult your doctor.
Yes, this is Attorney Tanya's program. What is it, Attorney?
Sa atin po ito. Sa atin po ito, Doc Alan. So it's finally happening po, mga ka-faithful. We know that it's a long weekend because of National Heroes Day and Ninoy Aquino Day, which was celebrated last Friday. And we're happy to announce na tuloy na po ang ating Community Potluck and Wellness Fair. So Lunas Pilipinas, together with generous support from CDC Ph, is holding this Salo-Salo on Monday, August 26. It's happening po at the UP-BGC campus from 1 to 5 p.m. So originally, we announced na it would be a 2-day thing. Because of the different developments over the past few weeks, we've downscaled. But the essence po is sana magtipon-tipon po sana tayong lahat, no? Lalong-lalo na po yung mga unvaxxed, yung mga freedom fighters, yung mga talagang lumaban po sa vaccine mandates these past few years, no? Let's all come together in community. Lalong-lalo na po dahil nagsisimula na ulit mag-ingay ang WHO ang DOH regarding monkeypox, no? So we're very happy that our doctors are at the front line. So Doc Alan, Doc Romy, Doc Marivic, Super Sally, discussing these important issues. So please join us. We have brought together a group of alternative healers, no? So you'll get to meet fellow advocates for health freedom. You'll get to meet Doc Alan in person, Super Sally in person, Doc Romy. They have promised to come, and there will be others who will come as well, no? We will have talks on health and wellness. We will have energy healing, massage, acupuncture. We'll be serving healthy food, and we'll also teach you how to take care of your immune system, boosting your immune system with good nutrition, and also how to detox. Marami pong nagtatanong kung paano mag-detox, and si Doc Romy is preparing his presentation on how to detox. We're also going to be distributing Doc Marivic's detox protocols for those of you who weren't able to make it noong May 18. If you come on Monday, we're also going to be giving copies of Doc Marivic's detox protocols. So we have an exciting program, 4 hours lang po, but it's going to be really fun. It's really going to be very information filled, and most of all, it's going to be community. We hope that you will come. There's a modest registration fee of 200 to cover the expenses, but we'll make sure po na busog po kayo sa puso, sa tiyan, at sa kaalaman. Yun. So please scan the QR code to pre-register. And next slide, Francis, for those of you wondering on how to get to UPBGC, pwede po kayo mag-commute. So you can commute going to Market. Marami naman pong mga bus, mga private vehicles which go to Market. It's a short walk na lang po from Market. Kung kayo naman ay may sasakyan, there's going to be ample parking at UPBGC. We have the whole place to ourselves kasi walang pasok. And you can access UPBGC either coming from C5, from EDSA, or from Pasig via the University Parkway. Yon. So we hope to see you there, and let's all meet in person. And we are all stronger together, and please know na hindi kayo nag-iisa. Marami po tayo at magkita-kita po tayo sa Lunes.
Yes, that's going to be very exciting, Attorney. I was so surprised you were initiating this, and this is really what we need. We need wellness. We need for all people who are advocates of wellness to go together and come up with something concrete that will, boost our health, practices that will help us to boost our health, to detox if ever we were vaccinated, and also to have more knowledge and awareness about, these things coming up that is actually going to be harmful to the health of many people, which they are not aware of, no? And it's
Yes.
being done by institutions, government and private, and we are surprised that these things are taking place at this time, and we know what to do about it. That's why we need to help each other and go together. And sana punta kayo sa Lunas Pilipinas program namin, BGC, UPBGC.
Yes.
That will be Monday, 1 to 5, no?
1 to 5, Monday po.
Okay. The next slide, Francis. Oh. Yes, why am I there? Actually, this is going to be October 12 in Miami, and last week during our huddle, Dr. Marvic was inviting me, so now I decided to go there. Now I was given a part there, so I will be discussing about the detox and well. I will be in the detox and well-being fair. I will be discussing about chelation, vitamin C, and ivermectin. So it's going to be an exciting golf cart parade, and there will be a fair on that whole day. So I'll be one of the guest speakers. There will be Dr. Per Corey, Dr. William Makis, several others, and Dr. Tess Lowry will be there. This is also sponsored by the World Council for Health. Yeah. So if any one of you listening to us, I know there are people who are in the States. Listen to us if you are near, or you can go to Florida, and let's see each other there. It will be exciting. The doctors, I have seen previous slides before me. they will be giving a lot of talks and a lot of lectures and demonstrations. Now we're in the monkeypox part 2. Was this fear mongering? Fear mongering or fear WHO mongering?
Doc
So,
Alan, sabi
yeah.
po nila dapat tanggalin ang K in monkeypox.
Oo nga. Okay. Actually, this monkey is not fearsome. This is funny, a funny monkey picture here.
Oo nga eh.
So, what do we say about the monkey? Is there any slide about this monkeypox now? Other than the ones given? Okay. So maybe Fran is just showing us the highlights. After discussing monkeypox, we'll be discussing about the attack on ivermectin. Here they go again, no? And what can we say about this issue that's taking place? This, yeah, I think it's a bombshell against ivermectin. Okay.
It's rather ironic. There's only a single current case of so-called monkeypox in the Philippines, and yet all forces are being mobilized against monkeypox. And they even discovered that this is a mild case, and yet Quezon City has done contact tracing, and they have 7 people under quarantine until the beginning of September. So they put them under 2 weeks quarantine.
Mm-hmm.
So it's quite. Do you think this is an overreaction, Doc?
We didn't see this coming, but we had this a preview of this 2 years ago, right?
Yes.
So it may be, we don't know really what they're up to, but it may be a way that they want to, create fear again that there's another pandemic coming, and so they really need to push their what do you call this, the pandemic agenda they have, this WHO, HR and all that, no?
And the pandemic treaty has not been finalized yet.
So they want to push it, so they would like to create things like this so it can be, people will be favorable to accepting it, and the governments will have justification for approving it. So maybe that's the reason. And I think also this ivermectin bombshell is connected with that, as a connection with that. Because ivermectin is the one that is going to go against it again. And of course, they have to malign again and create infamy against ivermectin so that people will be left with nothing, except for the whatever medicines they will want to give and the vaccines they want to give. So kawawa, our people are really, they're unaware, so they don't know what's happening. That's why we are here in CDC Ph Huddle, to inform everyone what is taking place, what is the truth about behind all these things that are taking place, and what we should do about it. Mm-hmm. So are these just previews, or are these the slides that we're going to tackle now? Kasi just earlier, before this was monkeypox slide, no? So do you know this Jacob Forsmed of Sweden, Sally or Attorney Tanya? I'm not so familiar about this.
No, I'm not familiar with this one. Is this a video, or Francis? Can you say something on this? Not quite sure. I find it quite interesting that Teddy Herbosa has already announced that he has given. Here we go. It's video.
Naganap ito isang araw lamang matapos ideklara ng World Health Organization o WHO na ang virus na ito ay isang public health emergency.
It's clear that a coordinated international response is essential to stop these outbreaks and save lives. A public health emergency of international concern is the
naman ang kailang unang kaso ng isang nakamamatay na strain ng Mpox ngayong Biyernes na siyang kauna-unahang kaso sa labas ng Africa.
Vi har också nu under eftermiddagen fått bekräftat att vi har ett fall i Sverige av den allvarligare typen av Mpox, den som heter Clade 1. Det är förstås någonting vi tar på allvar. Samtidigt är det här ett arbete som hälso- och sjukvården och de regionala smittskyddsenheterna kan och har upparbetade rutiner och system för att hantera.
Naganap ito isang araw lamang matapos ideklara ng World Health Organization o WHO na ang virus na ito ay isang public health emergency.
It's clear that a coordinated international response is essential to stop these outbreaks and save lives. A public health emergency of international concern is the highest level of alarm under international health law.
Ang Mpox po na dating kilala bilang monkeypox ay isang lubhang nakakahawang sakit na unang natuklasan sa mga unggoy na ginagamit para sa research noong taong 1958. Naiulat ang unang kaso sa tao taong 1970 sa parehong bansa na kasalukuyang nakararanas ng outbreak ang Democratic Republic of the Congo o DRC. Sa loob ng mga dekada, nagdulot ang Mpox sa mga sporadic na kaso at outbreak sa DRC, Nigeria at ilang iba pang bansa sa kontinente ng Afrika. Subalit, noong 2022, ang mga bansa sa labas ng Afrika, kabilang na ang marami na hindi pa nakararanas sa virus na ito, ay biglang nagsimulang magtala ng mga kaso. Noong taong iyon, idineklara ng WHO ang pandemya bilang isang public health emergency of international concern sa unang pagkakataon. Mahigit 90,000 na mga kaso ng Mpox ang naitala noon sa loob ng isang taon. Maaari ring mangyari muli ang pandemya na ito dahil sa bagong strain na umaabot na sa Sweden at sa 3 pang kumpirmadong kaso sa Pakistan naman. Ipinaliwanag ng mga opisyal ng public health na ang isang kumpirmadong kaso sa Sweden ay malamang na magpapahiwatig ng dose-dose ng hindi pa nahahanap ng mga kaso sa iba pang bahagi naman ng Europa. Gayon din, ang mga kaso sa Pakistan ay maaaring magpahiwatig ng daan-daang hindi pa rin nahahanap ng mga kaso sa mga kalapit na bansa, katulad na lamang po ng India at Iran. Ang Mpox ay maaaring magdulot ng lagnat, pantal at mga sugat, matinding sakit ng ulo, pagkapagod at ilan ay nakararanas ng kahirapan sa paghinga, pati na rin ang sepsis o pagkalaso ng dugo. Ang pinakakaraniwang sintomas ng Mpox ay mga pantal na parang paltos na karaniwang tumatagal po ng 2 hanggang 4 na linggo. Ito ay maaaring kumalat sa pamamagitan ng pagdikit sa mga taong nahawaan na, infected na mga hayop o maging sa mga materyales o mula sa isang buntis patungo sa kanyang hindi pa isinisilang na sanggol. Ang mga palatandaan at sintomas ay karaniwang nagsisimula sa loob ng 1 linggo, subalit maaari magsimula sa 1 hanggang 21 araw pagkatapos ng pagkakalantad. Ang bagong bersyon ng Mpox ay kilala na mas indiscriminate kumpara sa mga naunang strain at ngayon ay mas mabilis na kumakalat sa buong populasyon.
Alors, onde esalaki ke nazala contamine nsima nango mpe bana nanga misato bazwaki oyo ya liboso kuna nasalisaki ye awa esilaki baoyo ya mike nde ebongaki te tokendaki na bikoro juste après 2 semaines tobimi. Après 1 semaine encore, mwasi nanga pa kotombe malade.
Sa kasalukuyang taon po, mayroong mahigit 17,000 na mga kaso sa mahigit 75 mga bansa sa buong mundo. Ito ay higit pa sa 15,000 na mga kaso na naitalap para sa buong taon ng 2023. Sa Hunyo hanggang Hulyo pa lamang, nagkaroon na ng 77% na pagtaas ng mga kaso ng Mpox ayon po yan mismo sa WHO. Ang variant ng Mpox na ito ay kilala rin mas nakamamatay kumpara sa naunang outbreak noong taong 2022. 207 na mga tao ang naitalang namatay sa outbreak noong 2022, habang mahigit 1,000 nang namatay sa outbreak ngayon sa DRC. Bukod pa rito, higit sa kalahati ng mga apektado ay mga bata. Isa sa pinakamalaking risk factors para sa matinding impeksyon ng Mpox at pagkamatay ay ang pre-existing HIV infection. At sa Africa, mahigit 25 milyon na katao ang may HIV, higit pa sa anumang ibang rehiyon sa buong mundo. Naku, ibig po sabihin niyan, maraming bansa sa Africa ang maaaring makaranas ng mas nakamamatay na mga outbreak kumpara sa ibang bahagi ng daigdig. Kasama na rito ang kasalukuyang mabilis na pagkalat ng Mpox sa kontinente. May bakuna naman po para sa Mpox at kasalukuyang may 200,000 doses na available sa Africa. Subalit, ayon sa Africa Centers for Disease Control and Prevention o Africa CDC, hanggang 10 million doses ang kailangan para maibsan ang emergency. Mayroong hindi bababa sa 2 bakuna na posibleng gamitin. Ang isa ay Jynneos o Imvanex sa Europe na gawas ng isang Danish company na tinatawag na Bavarian Nordic. Ang isa pa ay ang LC16 na ginawa naman ng isang Japanese company na tinatawag na KM Biologics. Parehong epektibo naman ang 2 bakuna laban sa Mpox, subalit hindi pa malinaw kung gaano nga ba ito ka-epektibo para sa bagong nakamamatay na variant. Ngunit hindi pa rin malinaw kung ang mga bagong emergency designations ay magkakaroon ng anumang epekto sa availability ng Mpox vaccine. Bukod pa po rito, iniulat ng Africa CDC na iwasan muna ang pakikipagkita sa mga posibleng infected na ng virus, mas lalo na sa mga pagtitipon na may maraming tao. Binigyan din rin nila ang pag-iwas sa mga tao na mayroong rashes, mga pimples, blisters o scabs na posibleng dahil sa Mpox, at huwag ring hawakan ang mga bagay na ginamit ng mga infected. Madalas ding maghugas ng kamay gamit ang sabon at tubig, mas lalo na bago kumain o bago hawakan ang inyong mukha. Ngunit, pangunahin pa rin ang bakuna upang maiwasan na mahawa sa Mpox. Sa deklarasyon ng isang public health emergency of international concern, umaasa ang WHO at Africa CDC na mapabilis ang pagsubok at paghahatid ng mga bakuna sa mga apektadong bansa. Kamakailan lamang naglabas ang African Union na mahigit 10 milyong dolyar na pondo para sa Mpox response. Habang ang WHO ay nangako ng hindi bababa sa higit 1 milyong dolyar sa emergency funds at posibleng karagdagang pondo sa paparating pa na mga susunod na araw. Sa kasalukuyan, dedepende na lamang sa kung gaano kabilis o gaano katagal ang responde sa internasyonal na komunidad. Kapag na-delay ang tulong o paghanda rito, posibleng lumala ang pagkalat ng Mpox, hindi lamang sa Africa, kundi maging sa buong mundo.
Okay, Sally. I think that news clip from Net25 was 2 weeks ago, if I'm not mistaken. Ano? And right now, it's kasi they were just announcing there were 1 case in Sweden and another 4 cases in Pakistan. But now there's in other places. There's in US. There's also in the Philippines, of course, and many other places. No?
In Australia, they say they have several hundred cases in Australia.
So, anyways, this is coming out, but one thing that we are seeing, why this is taking place, this is not really a very contagious, no? Unlike if you compare it with SARS-CoV-2, which is airborne, it can spread so fast, but this one you need skin-to-skin contact, no? And what we are seeing is the possibility that why this is spreading now is because of the COVID-19 vaccine, which the COVID-19 vaccine has caused immune dysfunction. That means the immune system of the people who receive the vaccine has weakened to the point that they can easily succumb to, they can easily manifest, become symptomatic with just any simple viral infection. And this is not really that virulent form of infection. Maybe in between smallpox and chickenpox. Not not as strong as smallpox, no, but not weak, not as weak as chickenpox. But then this is a family of pox viruses, so um, whatever is useful against the pox viruses can be useful also for monkeypox. An example is ivermectin. I am saying that it would be also something that will do very significantly to counter monkeypox infections.
Yeah, the treatment for monkeypox is symptomatic, correct, and supportive. It doesn't look like there's any specific treatment required in most cases. Although I presume if there was secondary infection, antibiotics might be considered.
Yeah, that's what we do with chickenpox. We give prophylactic antibiotics because these pox lesions can, they can have an opening there, and then secondary bacterial infection can come in. So we just need to prevent those secondary infections. But Sally, it's very surprising. Dr. Tedros, although he's not a doctor, no? Tedros Ghebreyesus. We're expecting WHO director to be a doctor at least, right? A medical doctor. But this Dr. Tedros, who is not a doctor, no, is saying, is calling for the highest level of alarm. That's the term he said. This calls for the highest level of alarm. So it's like the same thing that they did with SARS-CoV-2. No? The only thing lacking is to declare that the world is in a pandemic again. No? But they are alarming. They are sounding the alarm for the highest level, on the highest level. So what does that bring to your mind, Sally?
I think it's rinse and repeat. What happened last time? Um, I think they need to have the world in a state of constant fear. This doesn't strike me as a very severe illness at all, and
Yeah.
it's endemic in Africa. And although they've been saying that people have died, apparently most of the people who died had other illnesses or other infections, and it wasn't monkeypox that killed them. And I refuse to call it mpox. I want to call it monkeypox.
Yeah.
And then we also have to be concerned that they're pushing smallpox vaccines. So smallpox vaccines are live vaccines, I understand, which could also be risky and cause their own complications. And I understand that the side effects of these smallpox vaccines are around 3% of recipients have side effects, and some of these can be serious, including death. So
Yeah, that's true.
a healthy and one of the major side effects is myocarditis, pericarditis is a known side effect of these smallpox vaccines. I just had a look at the drug and health on smallpox vaccines, and it has a warning. It says the side effects are myocarditis, pericarditis, encephalopathy, vaccinia, severe vaccinal skin infections, meaning people could get a smallpox vaccine and then end up with an outbreak of wounds that are actually like smallpox, vaccine-induced smallpox. The side effects also say certain individuals are at an increased risk, which may lead to severe disability, permanent neurological sequelae, and/or death. So it seems that these smallpox vaccines are not to be taken lightly, and should they're saying they're using these as emergency use authorization for monkeypox.
Yeah, but it get me into thinking, Sally. It's not only the smallpox vaccine right now. No, I think it's like the world is watching a circus. No, because they just announced that Japan has come out with they call it LC16, and Sweden has come out with Jynneos IM-Vanex vaccines against specific against monkeypox. Are The way I look at it, these are not smallpox vaccines. These are vaccine designed for monkeypox. But then, are they really that good to come up with a vaccine right away? You know?
Well, these were smallpox vaccines that they say are cross-reactive for monkeypox.
I don't think that will be sound. You know why? Because we have always had chickenpox, but we never use smallpox vaccine against chickenpox. And a lot of people have smallpox vaccine. Like myself, I got smallpox. No, most baby boomers have smallpox, but we still get chickenpox. Of course, if we give smallpox vaccine, I think it won't work with monkeypox. That's specific. Vaccines have to be very specific on the pathogens they are attacking. They're making the immune system confer an immunity to. So I don't think it will work by giving smallpox vaccine. But then coming out with LC16 and Jynneos IM Vanex, I don't know how they came out with that so fast with those kinds of vaccine.
Yeah, I think they were pre-existing vaccines. They've been in use for quite a long time.
Okay.
Oh, anyway, it looks like the World Health Organization is making a big buck again. And the
Mhm.
makers of these vaccines are also having a very big rise in their stock. So, is the smallpox or monkeypox vaccine something that would be recommended for general people or general population?
Mm-hmm. Yeah, but
Would it?
did you notice, Sally? It started in the DRC in Congo, no, Democratic
Yes,
Republic of Congo,
yes.
and the justice was also saying about HIV in Africa and the number of 25 million. So I see a connection there that this monkeypox is attacking people who are very what you call susceptible to it, especially if they have the HIV. And
Yeah,
after rolling out the SARS-CoV-2 vaccines, I mean the COVID vaccines, people are not aware of it that the SARS-CoV-2 vaccines is a way of evading the immune system. I mean the SARS-CoV-2 itself, no, the spike protein from the vaccine has a way of evading the immune system, causing a condition of a relative acquired immune deficiency among those recipients of this vaccine. It's not good. It's not a good thing to hear that, but I will have to discuss it here for the as a matter of discussion. That people who are, I will repeat it again, who are COVID, who have received COVID-19 vaccine are in a way,
immune suppressed.
yeah, developing an acquired immune deficiency, and so they can easily get any opportunistic infections like mpox. They can easily get cancers. No? So these are the outcome of HIV virus in creating havoc on the immune system. But SARS-CoV-2 has a way also to evade the immune system. That's why immune dysfunction is common. And then any simple viral infection like mpox can spread fast and can infect a lot of people.
But the good thing that everybody needs to know is that this mpox is not very contagious, and
Yeah.
it's only contagious from someone who's got open wounds. So it's actually which will be visible. So I think this is something that could easily be avoided, and I don't think there's any need for people to be worried about this infection. What we need to be worried about is the government's response and any potential, they're already quarantined people and track and tracing. So we need to keep ourselves very practical about what's really required for this illness or infection.
Yes, that's correct, Sally. But I will have to qualify your statement in a way that
Okay.
people will not be, you know, uh, become complacent. That anyway, I don't have an open wound, so I won't get it. No, it's not that. Chickenpox, you know how we get chickenpox. No, we can get it just by casual meetings of another person with a chickenpox. So that's why we isolate people with chickenpox. I think the same thing goes with mpox. No, we don't know kasi where the environment of the person who has the illness, who has the virus, who is infected with mpox. We don't know where the virus has been transferred, maybe on chair, on anything he touches, or in and so close contact with that person may somehow the virus will find a way to get into to another person. No, so not necessarily with an open wound, but we have to be careful also. No, we have to just avoid being in contact with them. Although we know that it's not airborne, but if you are staying in the same room, there is a possibility that you can get it also. No, kasi I just want to dispel some misconception. They're saying it's sexually transmitted, but it does not mean it's only through sexual contact that it will be transmitted. It can be transmitted in some other ways because we're dealing with viruses here. We are dealing with contagious pathogens. So there's a sense in alarming for a caution, but not the highest level of alarm that Dr. Tedros is saying, no, or the so-called Dr. Tedros. Not that high level. And then, as you were saying, this is not that virulent virus that will cause a lot of deaths, no. Although they said that 1,000 people died already in Congo, it may be true, and of course, if they are practicing proper journalism, then it must be true. But then, considering it's Africa and HIV is so common in Africa, that's why
And
they are dying.
malnutrition,
Yeah.
and many other diseases like tuberculosis and malaria.
Yeah, and they have poor sanitation there. There are poor water supply, poor sewage disposal, garbage disposal, poor nutrition, as you said. So you can expect that they can easily succumb to these infections. No, that's how Africa has always been. Diba? Okay, so what I am seeing here is actually, as you said, they want to keep people afraid, scared of many different kinds of potential pandemic pathogens coming out. No? But then, what's the reason why they're doing this? Diba? So, I think it has something to do what they are pushing. The agenda they're pushing are the pandemic treaty that a lot of nations are already defying, but they will still want to push it. So they will have total control of all the member nations, to submit to WHO's control of their health administration. Diba?
Yes, and there's more agreements than just the pandemic treaty. There's also other agreements related that the UN are also pushing other control strategies. So I think this is all part of their strategy to have more control in selling products and mandating products, particularly because there's a lot of money to be made if they can mandate or force people to buy their products.
Yeah. So pathetic we are in this kind of situation. No? That's why we are speaking up here in CDC Ph how irrational things are taking place, no? How irrational things are being done, and we just don't want to be just so docile and so subservient to them and just follow them blindly, no? And we should not be, kasi we will be on the losing end. No, we will all be on the losing end, just like just like this COVID vaccine. I was showing the numbers. 80 around 79.5, say that 79.5, a little bit over 79.5% of Filipinos don't want the vaccine anymore, the SARS-CoV. No, although around 60% were vaccinated, 48% retracted, never wanted to have the booster anymore. So only a handful, about 20+% had vaccine and boosters. So people are realizing something was wrong with that vaccine after a lot of them already gotten the complete vaccine, the 2 shots. No, they don't want to have the booster anymore. So what does that show? it only shows clearly that 80% of Filipinos, around 80%, does not want the vaccine anymore. So, but a lot of them have committed getting it, and to be remorseful that they had gotten it. Maybe they have seen a lot of people having problems, having health issues, and some people even dying from the vaccine can attack what they got afraid they didn't get the booster anymore. They didn't allow the booster anymore. So the same thing can happen with this MPOX. Now they're pushing on the vaccine. No, they should be pushing first the therapeutics, and we have a lot of potential medicines for therapeutics, and even just the sets of herbals can be very effective against it. No, I have seen a long list of different herbals that can be effective against mpox, against the monkeypox. So why push the vaccine, di ba? And that this brings to my mind. Do you recall, Sally, the pertussis issue a few months ago?
Pertussis, yes, yes. The pertussis vaccine, yes.
Yeah, how many cases we had that that caused an alarm for the government to procure millions worth of this
Oh,
vaccine.
well, the
And I,
pertussis vaccine is on the pediatric schedule, and the problem with the pertussis vaccine is it doesn't prevent pertussis. In fact, it can make recipients more likely to catch pertussis multiple times. So again, it's a problematic vaccine, and it's widely used in the population.
yes, it's part of the basic immunization set that are given to the pediatrics, no, to the pediatric population. Do
And
you have,
it's also included in the when people are given a tetanus vaccine. They say it's tetanus, but it's DTaP. It's diphtheria, tetanus, and pertussis. So adults are also given this vaccine. Anytime someone goes to the hospital with any sort of wound, they will be offered a tetanus vaccine, which includes pertussis.
yes, I've been telling Sally that is part of the basic immunization program. So every child will be given a DPT and oral polio at 2, 4, and 6 months. So they're given that, and then they'll be boosted later on. And it's all part of that. But then, why? My question then was, why administer a new set of pertussis alone, without the DPT, when you have already given these children the DPT, the pertussis? So what is that? No, I don't see any soundness in that, in doing that. But then that's what they're doing. In the same way, I don't know if you remember what took place in 2019, just before the pandemic. In the Philippines, there were cases of polio. Just two cases. The attack rate was only two cases somewhere in Cebu. And what they did an Oplan Patak, something. These are
Yeah,
this
mass vaccination for polio.
for polio. Although it's just oral, they went, the barangay health workers were going around the barangay and just looking for all the kids and giving them the oral polio. So
Uh, Doc, I think there's some sort of belief in vaccines being magical. Because anytime there's any infection discovered, then there's suddenly another, vaccination program rolled out to all the children. And I saw today that Teddy Herbosa was very proud that the Philippines is now number 6 in the world in unvaccinated children, whereas before we were number 5, meaning that the Department of Health's catch-up programs to vaccinate children is actually capturing some of the children who've never been vaccinated.
so
So,
Philippines is the number 6 most full country in the world. No,
number 6
number 6.
country with
Yeah,
unvaccinated children, or
yeah,
children who have never been vaccinated.
yeah. Sally, any right-thinking doctor will have to question this kind of things that they're imposing. I don't know why most doctors are so docile and just accept whatever the health authorities are saying. But of course, there are a lot of right-thinking doctors who are questioning this. But doctors are not really that. They are not. They are not inclined to do something revolutionary, no? Something that will cause a reactionary uh, response, no? But then I'm sure a lot of doctors are thinking that something is wrong with these kinds of policies, no? But then those doctors who are just are just following whatever the health authorities are saying, they're not already using their critical thinking. Every doctor
Well,
should be using critical thinking. Once they lost it, I don't think they're good doctors anymore.
it's not, the mainstream narrative is that vaccines are safe and effective. And if your child becomes sick or has SIDS or has autism following a vaccine, it's nothing to do with the vaccine. That is the mainstream narrative. And what I've seen is that people only question this when they have some first-hand experience, usually in their own family or their close friends. But that does make me question because the pediatricians are the ones giving vaccines to the children, and then they surely must see some of these children coming back sick soon after, but not putting two and two together, or just wanting to follow what they're told without question.
Yeah, the reason for that is because the previous vaccines before the MMR, most of them were perfect vaccines. A certain pathogen and a certain vaccine can prevent that, and they were able to eradicate different kinds of infectious diseases. Like for an example is poliomyelitis. No, after they have almost saturated the whole world with poliomyelitis, there's no single case of polio. Just a very sporadic or erratic case, and very rare in certain areas, and mostly kids who were not given those vaccines. No,
But
so
the
that's why the medical community has a strong belief on the vaccine. And I, for one, was also believing on that until I realized after the MMR, that's where the whole problems are coming out. But doesn't mean that the other vaccines are bad. The other vaccines are the way I look at it, they're so good, no? And every vaccine are given all actually their rating. For example, BCG, it's for tuberculosis. We give it every child born. I think just the first month we give BCG. It's for tuberculosis, but we know the rating of that is only 60% efficacy. So that's how it goes. No, that's why we have strong beliefs on the vaccine. But now these newer vaccines are creating problems, greater problems than what it's supposed to solve. So we are against those. And for example, coming out with the coronavirus vaccine, it's totally unsound because for many years or even decades before the COVID-19 pandemic, they were attempting to produce a vaccine for corona virus. No, it's a cold virus. They could not bring it out because they know it's an imperfect vaccine. It won't be effective. And suddenly here they are coming out with what they call effective vaccine because simply because it has a different technology using the mRNA technology, and they were experimenting on the people, and now it turned out to be what it is. It's not effective and it's even harmful, causing the same problem that the virus itself is causing, immune dysfunction. So that's what I'm saying is every doctor should be practicing, should be exercising critical thinking. We cannot just follow health authorities because our health authorities are just following a so-called Dr. Tedros, who is not a doctor. So, and they were saying this decision is coming from consultations from many groups. And who are these? We don't know who are these people they are consulting with. And so, how can we believe them? And now we have seen the result of these COVID-19 vaccines. Although a lot of people, even doctors, are still incognizant or in denial of the harm that it has done to some people, and so it doesn't dispel the fact that it's not safe, that it is it's not safe and it is not effective. No? It still has a lot of yet to be accepted, but we know from our end, from our side, we're so aware of it. No, just the other doctors, the other court on the other side are just made to, made to believe on the misinformation that were coming along during this time. Mhm.
Okay, so let's go to the next slide.
Yeah, let's go to the next slide. Francis.
Ang Pilipinas sa World Health Organization para makakuha ng bakuna laban sa Mpox. Ang kay Health Assistant Secretary Albert Domingo, isang Pilipinas sa mabibigyan ng bakuna kapag naipamahagi na ito sa iba't ibang mga bansa. Sa ngayon, aniya ay tinututukan muna ng WHO ang pamamahagi ng bakuna sa Africa dahil sa pagtaas ng kaso ng Mpox. Nilinaw din ni Domingo na wala namang problema sa mga pasilidad na paglalagyan ng bakuna dahil maaari namang gamitin ang mga pasilidad na ginamit noon sa bakuna laban sa COVID-19. Ang Pilipinas ay nakapagtala na ng 10 kaso ng Mpox. Huling nagpositibo sa Mpox ang isang 33 anyos na lalaking nagpamasahe sa isang spa sa Quezon City.
Okay, 10 cases. Has anyone died?
No, 10 cases. 10 cases to date. Only one case this year. So we have one case for 2024 in August. No one died. Everyone has recovered.
Yeah, it's a very
So Doc, we have only one case who hasn't traveled, meaning that there must be sporadic local transmission. But and this guy was detected because he went to a dermatologist who saw the lesions and already was suspicious and sent him for testing.
Okay, they should tell us, is it really monkeypox or is it chickenpox? You see, what test are they using? Why they say that?
They're using the PCR test.
Oh, so
PCR
it's not
test.
specific. It's very unspecific. It has only, I don't know, the rating may be just 60% sensitivity and specificity. No, it may be chickenpox and not monkeypox. No?
And I've also been told that shingles can look a lot like monkeypox as well, particularly if it's atypical shingles in somebody who's immune suppressed.
No, chickenpox is what is generalized, and shingles is just.
It's along the nerve distribution.
Yeah, it has a dermatome. It covers only a certain dermatomes that is supplied by that nerve. No, so, but then it comes in clusters of chickenpox. But chickenpox is generalized throughout the body, just like monkeypox. No? Anyways, these are pox lesions. This looks the same. This will be looking almost the same. And there's no way of saying by just looking at it. You have to do a test. And what kind of test do we have that is specific for monkeypox? I don't believe
PCR
that's
test
monkeypox.
is what they're doing. They also do genetic sequencing to determine that it's not the serious type.
But do we have that already in the Philippines?
Yeah, they did. They said they had it sequenced and determined that it was not the clade, the clade that they're worried about. So it's the milder form.
Okay.
But they still have 7 people in quarantine.
Yeah, they keep fooling people, then people will become more wise, no? Yeah. So people will understand it's like the boy who cried wolf, no? They keep on doing that, then people will not believe them anymore. Anyways, let's move on. Enough of this monkeypox.
Exactly. Enough of monkeypox. I don't think we should be alarmed over a single case of mild monkeypox in the Philippines. We have a population of 110 million. So let's keep this in context. We have much more serious concerns with tuberculosis, malnutrition, metabolic diseases. So I think we should focus on what really matters. Anyway.
So we just want to make it obvious to the people that this upsurge in monkeypox in Africa has led Dr. Tedros, or so-called doctor, to declare the highest level of alarm. Funny, no? It's like
That is
we're
funny. It is funny. We should laugh at him. How does this compare even with COVID? It doesn't.
Mhm. And
Given the
even COVID does not merit such kind of level of alarm,
yes,
no?
COVID didn't, and this is less than COVID.
Had they
And it's
accepted the preventative and therapeutic measures, but they had the agenda to bring out the vaccine, diba? And here
yes,
it's so obvious they have an agenda to bring out another vaccine for Mpox, no?
and they're pushing these vaccines for children, because they're saying that it's children who are mostly affected in Africa. So maybe they would like to have this put on the pediatric schedule in time.
Mm-hmm.
So anyway, we should watch. We should watch very critically and with great skepticism, and not just accept what we are told without thinking. Okay, let's go to the next. What's our next slide? Okay, here we go. Here we go again.
Yeah.
Ay,
Asymptomatic
nako.
Mpox. How can you say that the person is asymptomatic Mpox?
An asymptomatic person is a healthy person.
So they're trying to make a fool out of all of us, no? But there are doctors who won't allow that. But I'm sorry to say there are a lot of doctors who are not using their critical thinking. They just keep on listening and
Yeah.
believing these narratives, no?
Well, President Marcos did say that the Philippines should be on the highest alert, looking out for monkeypox.
I don't know.
I don't know either.
I won't
my
comment political
my
issues.
daughter was at school and she has had insect bites and she was scratching them, and she came up with lumps from scratching her mosquito bites. And I got called by the nurse and told that she should get a medical certificate to clear her to come back to school because she had bites on her arm.
Just for that?
Yeah, just
They-
for that. I ignored the request because I told the nurse you can put calamine lotion on it and she'll be fine. And she was.
Yeah, even these people in the medical, I mean, like the nurses, no, they are very irrational with what they are doing. I've seen a lot of people, even I have issued a medical certificate, and these people who are not even doctors are trying to defy what I state in my medical certificate. No? So my patient comes back to me and say the nurse in our school didn't accept my certificate. I wanted
Wow.
to those nurse and just it doesn't happen. It didn't happen only in schools, also in workplace. The
Mm,
nurse in the factories or in the industry, they want to see what they want to see and they don't see what I wrote in my medical certificate. They don't accept that. So I don't know why these things are taking place. They're trying to assail my
yeah.
judge, and they pretend to know more. You know, they want to project
Yeah.
themselves that they know what they're doing when they don't. No? I don't know why these things are taking place. And then just like the
Let's,
slides that we have, is there such a thing as asymptomatic? How will you know that the person has mpox? It shows, no, if the person has like in chickenpox, you will know the person has chickenpox. You are seeing pox lesions there, diba? No such thing as asymptomatic chickenpox. Same way with
right.
mpox.
Okay,
So
let's move on.
yeah, yeah, that's good.
We should really laugh at this. We should laugh at this suggestion. Anyway,
Yeah.
next slide.
We laugh because we're so tired seeing all this nonsense, no?
Yes, it
But
is nonsense. And this is the contact tracing. Here we go. We have still more monkeypox. The person was 33 years old. They ordered closure of the spa, but it happened to have expired permits, which would be why it was closed. And strengthened surveillance. Okay, let's keep going.
Yeah, this news media, they make money when they make sensationalized news. No, these are not news at all. Should not
I
have
think
come out, but they don't they have to make money somehow, so they make a big
I
thing
think the me-
small.
I think the media has a lot to answer for
Yeah.
because the media has been full of monkeypox the last week or so. Every second headline is monkeypox, or else it's Sarah Duterte's book. And I think the media has a lot to answer to because this is not genuine news, and this is nothing to be, you know, maybe public information, but it's gone overboard.
Yeah, and the health authority, DOH has to have a say on it. Don't bring this news out. It will cause, the WHO should have said something like that. No, don't bring this news out. It's true, but don't bring it out. It will create fear, and we know how to handle it. We're handling it okay. They should have said something like that. But maybe they're the one pushing the news. Okay, bring this out, bring them, so we can procure the vaccines, and we can. I will shut my mouth. Why they
Yeah,
want to buy
yeah.
vaccines? I
A
mean,
needle in every arm means money in the drug manufacturer's
you
purse.
said it.
And I'm sure the Department of Health also gets money somehow when they get donated vaccines. So, I suppose there's some sort of incentives. But let's keep going. Okay, watch this. More monkeypox.
Pinaplansa ang ilalabas itong guidelines. Come on. I worked for government, and I know those guidelines are so, they whenever there's something they want to bring out, there are a lot of guidelines as if they know everything. That's how they project themselves. So the doctor will just follow them kasi they are posing as if they know everything. So the other doctor will just follow. But now we should do better, no? The doctor should be using their common sense and their critical thinking.
Yes. Okay, let's keep moving. Next slide. Okay. Okay.
This is the same
Here we
slide.
go. Another one. This is talking about nicotine, the use of nicotine for destroying nanotechnology. And this is, they're talking specifically about the spike protein. So in the alternative discussion or on the alternative media, there's been a lot of discussion about the medicinal use of nicotine. This is not in cigarettes because cigarettes are quite hazardous to health, but this is in nicotine as a direct supplement, and it can be done via patches or gum. And it's understood also to help with the symptoms of spikopathy, the symptoms of people who are having long COVID or vaccine side effects. Doc, do you want to comment?
No, I don't have any comment on that. No?
Yeah. Okay. So yeah, nicotine is a very effective medicine. I also know that in the province, if you get bitten by a leech and you're bleeding from the leech bite, the people in the province will take a tobacco leaf and crush it and put it on the leech bite because the tobacco leaf um, extract will stop the bleeding. So nicotine is a very important medicinal. It's just not good for you smoked. Yeah. So next slide. Oh, here you go. We had just discussed this. Department of Health is saying that there's no link between monkeypox and COVID-19 vaccines. Um, although how they would say that in the Philippines with a single case this year, I don't quite know.
Okay. What's stated here is DOH is trying to clear the matter which claim that COVID-19 vaccines has something to do with Mpox outbreak. No? So DOH is saying there's no connection, but we're saying that it's in Africa, and they have also rolled out the vaccine in Africa, and now there is outbreak of Mpox in Africa. No? So we know that COVID vaccine creates immune dysfunction. It weakens the immune system, so people can easily succumb to just any kind of infection.
In the vaccine adverse events, it also talks about the possibility of vaccine strain monkeypox or smallpox, because they talk about the possibility of vaccinia-induced infection. So that would be a vaccine strain illness, and that would be more likely in people with immune dysfunction as well.
Mm-hmm.
Okay, let's go to the next slide. Okay. Next slide is the truth about monkeypox jab. This is the video. Let's see what it says. There we go. We just wait for this to come on.
I researched the ingredients. Lo and behold, it contains the most lethal antibiotic ever created, Cipro. Yes, the same antibiotic that put me in a wheelchair 6 years ago and disabled millions around the world. If you notice the videos I post of patients walking again from wheelchairs, the majority replace this toxic toxicity, as the antibiotic Cipro comes with a black box warning, which allows you to make the right decision about your health. Thanks for watching.
Okay, so that was talking about the monkeypox vaccine having an antibiotic in it, which is a known toxic antibiotic. So the amount maybe is very small, but there's still health concerns related and possible side effects from the vaccine.
Yeah, but I don't totally agree with that video, because ciprofloxacin is a good antibiotic. You just have to use it the right way. No, he's talking as if ciprofloxacin is really very bad and toxic. Antibiotics are designed to be toxic. They need to overcome the pathogens, no, bacterial pathogens specifically. So, I think these kinds of slides haven't undergone screening from the doctors of Cdc Ph, so we're sorry to show this. No,
Yeah,
I don't totally agree with that. No.
I agree with you too, Doc. I think every medication has risks and benefits, and every medication needs to be used in the right patient for the right purpose, in the right dose, and with proper monitoring. So this is, I think, what we would be looking at, rather than just being fearful. So if someone really has a risk of monkeypox through their lifestyle, that may be something to consider. But if someone's lifestyle is not such, I think it's currently not relevant in the Philippines. We have one case. So let's
Yes,
wait and see and not overreact.
what we're trying to say here in Cdc Ph, as a doctor, I will say there is monkeypox. We cannot deny it. There's such a thing as monkeypox. But this kind of infection, this kind of contagious disease, does not merit to have the highest level of alarm. No, it is contagious, but not as contagious that they're portraying it to be. It is not deadly even. Just like COVID, they said millions will die. Hindi naman never in the Philippines, we only had 66,000 plus, no? Not a million. It never reached a million. Never reached even a tenth of a million. It never, so, and when they say millions, it's 2 million or more, di ba? So, mali eh. They're projecting it, and they they fooling the people, making them so afraid. And these authorities should have used the parameters in epidemiology, like looking into case infection rate, case fatality rate, and they easily they could have predicted, ganito lang pala, this will be the COVID. Hindi pala nakakatakot. Dapat they should have been like that eh. Kasi as early as February 2020, even before the pandemic was declared, there was already a controlled population that they can already determine the case infection rate, the case fatality rate of the COVID. They should have that cause an alarm, and they should have, they should have done better. We could have imitated Sweden without having to lock down and close the economy, close the industry, close agriculture, close tourism and schooling and all that. And they should not have rolled out the vaccine if they know better. They're not really, they're not really that scientific. They don't know what they're talking about. They're just receiving orders from WHO, whose leader is a doctor called Dr. Tedros, who is not a doctor himself. No? So I'm so fed up with all this foolishness that taking place. No? Forgive me to say this. No, mali so many things are going wrong. And this bagging pack, it's not a big deal. No, napakahinang klase. Ano ba klaseng tayo? Doktor pa ba tayo kung monkeypox lang katatakutan natin? Di ba? O, sabihin, tingnan lang ng numbers, tingnan natin ng numbers, then we know, we all have subjects of, we all studied the subject of epidemiology, so we can know what is taking place. Hindi tayo nagpapadala lang kung ano sasabihin ng DOH at ng WHO, na sunod-sunuran lang ng WHO. Di ba? We should do better. Okay.
Yes, we should do better. We should do better. But let's go to the next slide.
Next slide, please.
I think the next one is talking about, I think if I'm correct, is talking about Singapore. But we cannot see the full article. It's just...
Yeah, so the most vast country on earth is now facing a population crisis. Is it because of deficit in birth? I have not gone through this.
Okay, so Singapore is one of the most vaccinated countries on the earth. That is correct. I have been looking at their data. Their deaths they had a 10% increase in deaths in 2022 and another 10% increase in 2023. And then the deaths are still around the same level as 2023. So their total excess deaths, it's around, if you add cumulatively, they have 10% in 1 year, and then the next year is 20% because it's higher than the previous year. But what's also very concerning is that their birth rate has dropped very dramatically. So we would have expected Singapore to have a lot of babies this year because it's a dragon year. And in Asia, dragon babies, in Chinese culture, dragon babies are very desirable. But their birth rate is really very low. And if this continues, they're going to end up with negative population growth relatively, probably in the next year or so. So yeah, they're in trouble. Population crisis.
Yeah, we better take a look on the Philippine situation. I did my epidemiologic computations. Suffice for now to inform every doctors, everyone listening to us in Cdc Ph Huddle, that we are missing 949,000 babies from 2020 to 2023, the 4-year pandemic period. We're supposed to be 949,000 plus more, but we missed those. Na bumagsak ang ating births during those 4 years, and the highest was also in 2021 when they started the vaccine. So the vaccine is really causing a problem with fertility, with fecundity, with the birth rates being the measure. We look into 2015 to 2019, the 5-year pre-pandemic, and we computed for the trend. No, it's about 0.84% lesser and lesser every year. That's the trend. So we projected that and then plotted the actual births. We are missing 949,000 plus babies. That's how serious the vaccine brought into the fertility of Filipinos.
And this is only up to 2023, and I agree with you, because this is exactly what I've been seeing when I'm looking at the population vital statistics. And then I also see up to I think it's September, October 2023, we have around nearly 500,000 excess deaths, more than we would have expected. So that means that the Philippines is losing nearly 1.5 million people that it should have had. Nearly 1 million fewer babies and nearly 500,000 excess deaths. And we don't have any data yet for 2024. The government hasn't released any population data yet.
Yeah, so better look into that. And of course, this thing is not only taking place in the Philippines and the other countries as well. It's taking place in all those vaccinated countries, and it's all the whole world. No?
It's the whole world. What I see, I've been looking at the population data in Singapore, Malaysia, Hong Kong, Macau, Philippines, Australia, and what we see in every single country is that there is a step change. But whatever the deaths were prior to 2021, after 2021, they're suddenly much higher. And the birth rates also declining much more quickly. So this tells us that the vaccines really had a very adverse effect on population health.
Mm-hmm. So this is something that merits an investigation. What we had in the Congress was only an investigation on the death, on the excess deaths, but on the deficits in birth, nobody has given attention to it yet. And we want to bring it to public knowledge that we are missing 149,000 babies who should have been born in the Philippines from 2020 to 2023, 4 years. And
yeah, this is actually a population catastrophe. A lot of people have celebrated and said, oh, great, our population is now going to, this is what we wanted. We didn't want rapid population growth anymore. But, maybe we want a stable population. We don't want sudden massive decline, because this is also very problematic.
mm-hmm.
Okay, let's do next slide. Okay, this is, I don't know which country this is in. This is not in the Philippines, but there is one country where they've already ruled. I think, I'm sorry, I don't know what country this is in. I haven't seen the source. Have you seen this dog, or you're not aware?
I must have seen it, but I could not remember. No, but I'm not more into political things. No, but anyway, let's go to the next slide.
Yes, please.
Okay, these are questions being posed. It says, what should we do to avoid getting mpox? Is there a treatment for mpox? Yes. Are we going to answer this question now?
I'm not sure. There's also a video coming up, I think, from the World Council for Health.
With just different herbs. I've seen the list. No, number one is garlic, neem.
Yes.
How many other herbs there that can easily address mpox? The problem with Congo and the African countries who has this mpox and they have high deaths, not really that high. Imagine just 1,000, because they're immune. They have so much HIV there, and they are immune deficient. And they have malnutrition. They have poor sanitation. They are so poor. They don't have access to medical services, to hospitals. That's why they are dying from a simple viral infection. It will be a different story in the Philippines. We have a lot of herbs. We have so many things that we can do. Even ivermectin will work for that, and other medicines. We don't have to use ivermectin even. Even a simple garlic and other herbs will be working against mpox. It's no big problem. What do you say, Sam?
I agree. I mean, the most important thing for health for anybody is nutrition. And if you have good nutrition, then your body is going to be strong and have resistance against all sorts of illnesses and infections. And then you combine that with, hygiene, not over hygiene, but good hygiene. If you use too much soap, you can actually damage your skin's protective layer, because your skin is also a protective organ that prevents you getting infected. So, wash your hands if you do something dirty, but don't overuse sanitizers, because you don't want to disrupt your skin's protective barrier as well. So yeah, basic
Yes.
hygiene, nutrition, that's it. Soap and water is probably your best friend.
And what I have to answer for the first question, what should I do to prevent getting mpox? I will say never get the vaccine. CDC page will say never end up getting the vaccine because it has not been proven again. It is not a sound thing to do a cross reaction with to get a smallpox vaccine, thinking that it will have a cross reaction against mpox, and that's not an intelligent thing to do. No, so you don't address it by getting vaccinated.
Okay, and what if the government tries to mandate it? What do we do?
I don't know. The government, we just saw the video earlier. It's calling for the procurement of the vaccine.
That is
Now, before
correct.
anything else, let us welcome our president, Dr.
Hi,
Maridik.
Doc. Hi, Doc.
Hello,
She's on mute. She's
yeah.
on mute. We can't hear her.
You guys, I'm sorry.
You're on a train.
I'm on the train.
Right.
I'm going back to Orlando from Miami, but I don't think I'd be able to talk that long because there are so many people here. Probably you guys can hear the people talking. Yeah.
So,
Oh, that's all right. Nice to see you.
Sorry.
so you're attending the white coat ceremony of your daughter in medicine, no? Your daughter is taking medicine.
Magandang gabi sa inyong lahat. Let me see something if I
Yeah, we answered this question already. Okay, next slide, Francis. Yeah, that's that one, ivermectin. There you are. Ivermectin is under attack again, a threat to cancer industry and vaccine cartel. Anyway, this is by Dr. William Magis as an answer to what the bombshell of Mike Yedon. Now, can you please show first the Mike Yedon thing, Francis? Suddenly, this Team Truth came out that pig glycoprotein deficiency has something to do with the infertility of humans, and Mike Yedon, remember, I don't know if you have a slide about Mike Yedon. Mike Yedon is the vice president of Pfizer, suddenly defected against Pfizer. He's not in favor of the vaccination, but he was there all along, no? And suddenly, on the last moment, he defected against Pfizer. Anyway, he was a hero then, because people look at him as if he's really on the right, because he was right. No? But then suddenly, this time, at the height of mpox issue, now he's coming out defaming ivermectin, saying, do you have, Francis, the slide of Mike Yedon? He's saying it's the most toxic fertility toxin.
The most violent fertility toxin.
Yeah, that's the thing. Mike Yedon, ivermectin is an infertility bombshell. Ivermectin is one of the most violent fertility toxins I've ever come across, and he came across it only just 2 weeks before his press release. No? Just 2 weeks before. So his knowledge on studying on this matter is only 2 weeks.
Oh, well, I've actually done some reading on this. Can I make some comments?
Sure. Yeah, sure.
Yeah, so Dr. Mike Eden, it's very strange that he's come out this way at this time. But the studies, I've also done some reading now, and Dr. Jessica Rose, who is one of the very great researchers in the US, and she did some research on this topic because she said we need to answer people fairly. And the papers that Dr. Mike Eden is talking about were rat and mice studies, and the ivermectin was used in extremely high doses for an extended period. And then they found out that it affected the fertility. So we do know then that short-term high doses of ivermectin affect fertility in rats and mice. Dr. Jessica Rose then looked further, and she looked also to Africa, where ivermectin has been in long-term use. And what they see in Africa is where ivermectin is in use, fertility improves, it doesn't decrease. And that may be indirect, because if someone has parasites and then the parasites are treated and they're healthier, then their fertility will increase. There are also studies done in horses and cows, and in horses and cows, the ivermectin improved the sperm quality of the horses and the cows. So I think this might be an overreaction. My personal opinion, again, personal, is that ivermectin should be used at the right time, the right place, and for the right indication. If you are high risk or you have a cancer that might be treatable by ivermectin, I would think it's a very good choice for you. If you're a young child or a young healthy person, it might not be wise to be taking ivermectin for long periods of time. Because you're low risk already, and you shouldn't take any medication if it's not necessary. So, Doc, can you comment?
Okay, yeah. I came across this thing, and my first question is, why now? Why now?
Good
If
question.
Dr. Mike Eden knows about it long time ago, when we released ivermectin, he should have questioned it already. But why now? So I got my answer. He just came out with the data just 2 weeks ago. He's a toxicologist, yes, but he came across the data on fertility issues against ivermectin just 2 weeks ago, and with that just a very meager knowledge, he come out with this bombshell, and even about calling it the most violent fertility toxin. Come on. What?
Come on, let's talk about the COVID-19 vaccine's impact on fertility. I would say they might be considered violent anti-fertility.
Mhm. It's an issue about pig glycoprotein effect on mice and rats. That's the study that he's citing. And the conclusion there is only a possible fertility uh, issue. It's not even conclusive. But then they did a study on that on rabbits. It's inconclusive. They study on rams, on heifers, on bulls and horses and humans. It even improves the fertility. You see, and the conclusion in heifers, bulls, and horses, it even improves the fertility of these animals. Had ivermectin been really as what Dr. Mike didn't want to portray, that it's a very toxic anti-fertility medicine, or it's a violent fertility toxin. So, you know, people in the veterinary science should have they know better, no? Their task in animal husbandry is to promote fertility of animals. That's how it is in animal husbandry, right? You have to have your cattle with perfect fertility, your chickens, your goats, your cattle, your pigs, di ba? And if what they have been giving, one of the favorites that they're giving as anti-parasitic agent for these animals is ivermectin, then they should have observed this, and they should have made a conclusive uh, prohibition not to use ivermectin anymore if it's really affecting the fertility, but it's not really affecting. And why is Dr. Mike Hudon saying so? What is the reason? So my question is, why now? I got my answer 2 weeks lang. It's only he came to know about it just 2 weeks ago. Barely scratching.
Impossible.
Yeah, just
Impossible.
yeah.
There's some
Yeah.
agenda. There's an agenda behind this, and
Yeah.
I'm rather disappointed to see this from Dr. Mike Eden. Actually, given but he has had a lot of contribution, and I don't know why he suddenly
You know what's
why
behind?
this part.
Yes, Sally. You know what's behind this?
Because
What's
ivermectin is
behind this?
effective for treating cancer.
Yes, that's it.
Yeah.
Now they have seen how ivermectin is answered the turbo cancers to the
Yeah.
cancer that is going, skyrocketing now. Is going fast, is climbing on a fast rate because as an outcome of the COVID vaccine that they've given, a lot of people are getting different
That's
kinds
right.
of cancers. And now they're seeing ivermectin to be a very safe treatment for cancers. Effective.
And
And
not
Doc
only that,
Alan,
So,
go ahead,
it's
Doc.
100
Doc
billion
Alan, Sally.
Yes.
anti-cancer.
The other,
Yes, that's part.
this is, I don't know if you guys can hear me very
Yes.
clearly. I was able
Well,
to do something with the sound. But what's ridiculous about this, it's really ridiculous because we've been using it like for how long? For 40 years,
Mhm.
45 years, Doc Alan. And
Yeah.
yes.
why is it only now that they are saying this kind of thing? I mean, how long has it been used in Africa?
Mhm.
A long time, right? Yeah, and
Yeah.
I agree with the turbo cancer that's happening now, and a lot of the non doctors like us, and it's growing. The number of doctors actually utilizing this is growing so fast because it's readily available and it's already uh, proven. And a lot of people also, the patient, they're asking every single day when I see patient they're asking for it. What about ivermectin, Dr. Villa? I have my dad, my mom, my sister, have cancer, and we would like to try this agent. And obviously, a lot of you have already you've heard about the fenbendazole, and we usually use them together. There's no, you
Mebendazole,
know, yeah,
mebendazole, ivermectin
fenbendazole,
are
the
used in
azole.
combination for
Yeah.
cancer treatments.
And the other thing that I was thinking, I mean, this is just me, this is my opinion. The vaccine also causing a lot of infertility, and even in the beginning, miscarriages. It's a lot. So, I mean, I think this is going to be the ivermectin is going to be a sacrificial lamb again because a lot of people are using it, and then it's just a matter of time that Sally, your report, the birth rate is going down like crazy while the
Yes.
excess
Plummeting.
death is going up. So
Yes.
this is, I don't know. And to hear Dr. Mike Yeren also, I mean, put this statement out to me as, I don't know, preposterous or something. Yeah, there is, I agree with you guys. There's an agenda or there is a motivation behind this statement. And I don't buy it. I don't buy it. Sa mga kababayan po natin, huwag kayong basta-basta maniwala dito. Everybody is getting corrupted, and that is the thing. And this is not, as I've been saying, this is not just corruption. Ano po to? Makasatanas to. This is very evil, because they're trying to take away a lot from us because they just wanted to comply. And that's the first thing that we have to do. Whether we're talking about the vaccine, talking about the monkeypox, wag po kayong sumunod na because the more you comply, then the more that they're going to do it, whatever it is that they want us to do. The other thing, I don't know, I sent it to Francis, I think last minute. The World Council for Health already compiled, we have a compilation of all the, what do you call this, herbal preparation or plants that can actually counteract the effects of monkeypox. So you guys just get a copy of that. I haven't memorized it because there's a lot of them, and I have my own thing too. I just got so busy with my daughter, so I wasn't able to send it. But there's a protocol coming out, so we're gonna come up with something that everybody can use. But the main thing that you have to remember is do not buy into the what do you call this? Don't be fearful. You have to remove that because we got paralyzed the first time with COVID. We got so paralyzed from the fear that you got to the point that you would do anything, just to comply. So, look, Alan,
Yeah.
agree sa ano mo, sa ivermectin. This is, to me, this is ridiculous, really. This is
It's
ridiculous.
ridiculous, and it's also incredibly cruel because people with these turbo cancers don't have treatment options, and yet they're going to try and deny them this. And for someone with cancer, if you have a treatment, you're not going to be worried about fertility either. You're worried about keeping them alive and treating the cancer.
Yeah.
So
Sally, in some states here in the US, what they've done, so a lot of people are getting it actually from the vet store because for two reasons. Number one, it's it's cheaper for them to get the ivermectin in a vet store, and then it's kind of the same, the formulation, but the only thing about the preparation, the animal preparation of ivermectin is the fillers that they use, right? You know what they've done in some states? You need a prescription now from the veterinarian to be able to get the ivermectin. What the hell is that?
wow, wow.
So they would, they, I mean, the preparation of ivermectin for horses, for the animals in the vet store, they're just hanging. It's over the counter completely. But now, in some state, okay, I'm not 100% sure in Florida, but I'm gonna find out soon because that's what they're doing. So it's just a matter of, I don't know, this craziness that they're doing. This is a sign that ivermectin is really effective. I mean, for them to suppress it in any way they can, you know, it's ridiculous. So this medication is really in history where it's very useful and it helps a lot of people and they're trying to take it away. So, you guys,
Do
this
not
is another
comply.
reason, huh?
Do not comply. Do not
Do
comply. Do
not
not buy.
comply.
Do not buy in. Do not comply.
Yeah,
Do not allow people to get away with this. And if someone
yeah,
talks to you that they're scared of monkeypox, just reassure them.
yeah.
It's We have one case in the Philippines, and it's the mild type. It's not the serious type.
That's right. They are so scared of this medication that they have to do.
Yeah. This
I
And
guy.
it's
mean, this is
accepted.
ridiculous, right? But what else can they do? They're 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 doubling down. I mean, anong kalokohan yan? This is really, when I saw it, I was laughing. I said, these people are really bad, you know. Just like it sounded like Salvania, when he was like, oh, it's gonna poison your brain. You're gonna have meningitis or you're gonna have encephalitis. That was the time when it was just being introduced for the first time. It's good that Doc Allen was so strong during that time, and he was just like, "Oh, okay." I remember you were doing your, what do you call? You had a podcast, or you were doing session with the people, and it was being attended by so many people, and that was. I remember Salvania putting out that statement that it's going to give you encephalitis, you know. But I think we answered, we counteracted that statement. So we need to, uh, what do you call it? So we need to be very aware and be informed. Do your own research what this medication, repurposed medication, can do. This is really going to be put down because there's no money to be made. There's no money to be had if you use this repurposed medication, and it's so popular already, and even when the vaccine was rolled out, because we're using this. I'm using this like candy. Every single patient who's vaccine injured is on this medication. So that's
Yes,
all I have. That's all I have to say about that.
yes. To Cara Marvick, one concerned citizen was texting me after reading Mike Yadon's thing, and she was
Yeah.
worried. I was explaining to her, don't worry so much. You know why? People not only listen to what people are saying, they also look into the kind of person who is speaking. And we know
Yeah.
that Mike Hilton defected from Pfizer. He used to be vice president of Pfizer. He defected. And now my question is, maybe he's redeeming himself. That's why he threw this bombshell against ivermectin to redeem himself. Because, cancer industry and the cancer medication is $100 billion worth of industry.
Yeah.
And again, ivermectin is a big slap against this industry. It has been a big slap on COVID-19 vaccine, and now it's a big slap on cancer chemotherapy, and radiation and all that. Because he's a
Yeah.
more sensible, more practical way of handling cancers now. It's turning out to be ivermectin and the other repurposed drugs.
Yeah, I know. I don't know. We just keep on fighting. We just keep on fighting. Guys, I just remember there's a group chat in Viber, headed or was created by Chestnut. Chestnut, okay? You have to look for that. You have to join that chat or that group because he has the most, if not the most extensive, but he's got so many compilation of anything about ivermectin. So shout out to Chestnut because I like his group chat. I don't go there all the time because for the same reason I cannot keep up with all the chat. But I remember Chestnut has the most what do you call this, papers and information about ivermectin, and he's been doing it since the pandemic. You know, even things from. He's a big fan of yours, Dr. Alan Chestnut. If you look at the Bible and then look at that, you're gonna see he's posting all the time what you do with the ivermectin. So you guys go there. I usually don't produce anything, but this is the time that if we want to keep the ivermectin going and afloat, we should support that, or you should know more, or you should keep yourself informed and get all the knowledge about this this medication,
How do you spell
anti-fertility.
chestnut? Just the chestnut nut? Is it
Chestnut. It's like
the, the nut?
the
The
yeah,
chestnut nut.
the nut.
Yeah. Okay.
See,
Okay,
Chest.
yeah,
it's not on Viber.
chestnut. Yeah. So
Okay,
shout
we can
out to him. I like what he's doing. Yeah.
Okay.
search.
So, Francis, do we have another slide?
Yeah. Oh my God. Okay.
Oh, this one. Maybe it's Dr. Marvick explain this.
Oh, I think
Dr. Lawrence.
no, this is the video that we made for
I'm Dr.
our.
Tess Laurie of the World Council for Health. The World Council for Health is. Hi everyone, I'm Dr. Tess Laurie of the World Council for Health. The World Council for Health is a decentralized people's organization advocating for a better way to get and stay healthy. It involves choice. We are delighted to be working closely with World Council for Health Florida's inspiring team, and we encourage everyone in the US to get behind this people-led initiative and take back control of your health. World Council for Health Florida is holding a detox fair this October to help you do just this. Do you put your family's health and well-being in the hands of big pharma, big food, and big tech? Well, there's a better way. Through nutrition, healthy practices, supplements, and independent professional advice, you can rediscover the fun of being human. I intend to speak about this and our new detox booklet at the World Council for Health Florida Detox Fair. If you are eager to get ahead of the curve, please do visit worldcouncilforhealth.org and download your copy of our detox booklet. I will also be speaking about the Better Way vision and principles. It is this World Council for Health Better Way ethos that is connecting people of all languages and cultures to help us work together to create a better world. Do come to the Detox Fair on site in Florida in the villages or join online. The choice is yours. Either way, do take care of yourselves and your families at this time of great change and join the movement towards a healthier and more sovereign you. Thank you.
Wow. Thank you. Thank you so much. Oh, may magandang balita ako. I have a very good news in relation to this. Doc,
Oh, we're not getting a good connection.
Yeah, that's a train. Did you hear me, guys? I was saying Doc Ann is going to join me in Florida World Council for Health Detox.
Yeah.
Yeah, Doc Alan. So I'm gonna be making a poster just like that very soon. Oh my God!
You already made.
Hey,
Yeah, I'll be there.
it's already made. But
Dr. Homer Lim said just go. So I don't know here. I got my chicken. I have to go. And I'm very excited to be there. Yeah, meet the other doctors and the people there, and Dr. Marabik, of course.
yeah.
And it will be a very exciting day, October 12th, in Florida.
Doc Alan, you have Florida. Doc Alan, you have to address that ivermectin. Between you and Dr. Corey, we should be able to counteract whatever. Yay! Yay!
Yes. Yeah.
Francis, thank you. Sally, Doc Alan is gonna be with me.
I'm jealous. I'd love to join you one of these days, but not this time.
Yeah.
I'm preparing few slides, but it's something that will be very, myself, I'm so amazed about the materials, no? So I'm sure Dr. Corey would, and the other doctors will be very interested in seeing my slides.
That's right. That's right, Doc
It's all about,
Alan.
it's about cancers. It's about cancers. No? I'll bring out that slide when I get there.
Okay, excellent. Pinoy power, Pinoy power. Kaming dalawa. Oh my God. Okay, we come to an end, I think. Thank you, Nadal.
Yes. Nearly 2 hours.
Okay. Finally,
Oh,
we
really?
ended on time. That's it.
But yeah, and I'm sorry, guys. Really, I was trying to log in earlier, but what can you do? Well, and Super Sally, I cannot thank you enough, for being with us every single time. If you were here or if I were there, I'll hug you like crazy. I'll kiss you like crazy.
Oh,
And
we're going to do
something,
that when we meet. We will.
and Doc Alan, I will have the chance to do that when he comes to the U.S., to Florida. I'm so excited about this. I can't tell you how excited I am. So, Doc Alan is going to be with us and probably will go live with you when he's with me. Okay?
Okay.
All right. So, the we're at the end. So, gusto ko lang po magpasalamat sa mga lahat ng nakikinig ngayon and talagang wag na kayong sumunod kahit kanino because what they're doing ay napakasama. Hindi ito ang totoong buhay na nangyayari sa atin, but then alam nyo na kung sino kalaban natin. The enemies are so really powerful, and they have so much money. So, but we keep on going, okay? Because people like us, we are the one telling the truth. We are the one doing whatever it takes to fight these forces, these evil people and forces. Magandang gabi po sa inyong lahat, and sa susunod uli. Okay, Sally, any parting words before we close?
My parting word is I'd like to remind everybody to do what you need to stay healthy. And I have a list of 12 things I'm going to tell you to do to stay healthy. Number one is get your sun exposure every day, because vitamin D is excellent for your immune system. It's also good for your mood, and it's also good for your hormones. So vitamin D is the number one thing you can do for health. Drink pure, clean water. Avoid sweetened drinks and sodas. Avoid junk food and eat whole unprocessed foods. Avoid your seed oils. Get enough sleep. I know that's hard, even for all of us. We need to do that, but try and get 7 to 8 hours of sleep a night, not just catching up on the weekends. Be physically active, and this can be housework or gardening as well as exercise. And then spend quality time with your family and friends. Be active in your community. Pray or do whatever you need for your spiritual development. Find beauty and joy in every day and practice gratitude. We are all still here. We are all connected to each other, and we are going to get through it. So blessings to everyone.
Dr. Alan,
Yeah,
ikaw.
I would like you to look back into the account in the Bible when Isaac was asking his father Abraham, "Where's going to be the sheep that will be sacrificed?" He said, "God will provide, Jehovah Jireh." And during the pandemic, God provided ivermectin. It saved millions of people. And now, still that provision is helping a lot of people in cancers. And so, I would say, the evil people will never win. Evil will never win. No? And the human body is the temple of God, so they should not trample, they should not meddle, they should not intervene, and they should not do something crazy about our body. Do not let these crazy vaccines get into your body. Take care of your health. We all have to be healthy so we can serve God better and our fellow men. We can do the good things that we need to do. So that's all for tonight. Thank you for being here, Dr. Maravik and Super Sally, and all the things that we learned today. And of course, our viewers, we know without you, this advocacy will not prevail. No? But because there are you, there is you there, and we are all doing fine and enjoying what advocacy we're doing, because this is the most fulfilling of all when we are able to help our fellow men. Good night.
Yes, good night. And thank you to
Okay.
Francis, our ever faithful Francis.
Good
Yeah.
night.
Good
Good
night.
night.
Okay. Good night. Good night.
Bye-bye.
Bawi na lang sa susunod. Oh, yeah. Okay.